crowd is going to be my guess.
What funny? Or we were talking to somebody who was driving and we held our head this way too long. We were looking at the computer screen and then, oh, there's our head ramp. Oh, and it makes our low back hurt too. Why is that? So there's that spine that connects all of it. And so the things that we do in our life and how we do them and how we prepare to do them are very important to give awareness to and notice the sensations. So I want you to be safe. Most of the time, our shoulder pain is a function of activity and movement or lack of. Notice I say lack of activity. So when you're in one position for a long time and you're just sitting there, and then you do that and you're like, oh, that kind of hurts. There's hurt and there's other hurt. So that feels uncomfortable because we haven't moved that shoulder. And that one wants to move too. But if you sit in one position for a long time, that myofascial tissue gets stuck. And so that's why shaking out, like we do in Shake It Up Baby and Ageless Grace, that's very important. Not just because it's fun, and it is fun, but it has a very important physical purpose to shake out your arms and your shoulders and your head and your hips and your whole body, because that connective tissue connects everything. So that gives us some movement. If you watch animals, remember that's what they do. The first thing, they shake. My dog gets up in the morning and she does a down dog. Very good. She does an excellent down dog. And then she shakes and she gets loosened up in that myofascial tissue because she's been curled up in a ball all night in her little bed. She's such a big baby. So most of the time it's activity or lack of activity that causes us that temporary discomfort. And it might not be to the shoulder. It might be in the neck, in the upper back. If it's deep inside, and I wore this so you could see, if it's deep inside this, and you can touch that spot, there's a little depression, soft spot. If it's deep inside there, that may be a good reason to see your healthcare professional. And if it's chronic, if it's all the time, if it's radiating down your arm to your fingertips, that's very important. It could be your heart, it could be your lungs to have that radiating pain. So again, see your healthcare professional. Also, if you have a history of cancer, anywhere in your body, actually, and you have a sudden onset of pain, but particularly if you've had breast cancer and you've had surgery, you know they give you a lot of movement to do so that connective tissue and that scar tissue doesn't inhibit your movement in your upper body, because that's part of your balance. And also we want to be able to hug, and we want to be able to lift things, and we want to be able to wave, and do all those kinds of things. So be aware. If it's chronic pain, again, see your doctor, see your healthcare professional. Those are just some things you need to be aware of. But there's a difference in that kind of pain in either overuse or not using those muscles and that connective tissue and all those tiny, this is a very, your lower body has big muscles and big bones. This part is very tiny articulating movements in our upper body, so we can do all of these kinds of things. We don't typically do this much kind of movement with our lower body, unless you're in our class, and then you might. So if you're doing something in a type of movement and the pain goes away, that's that's okay. You want to be aware of that. Notice what kind of movement it was and dial it down if you need to. I say turn the volume down or turn the volume up, but you dial what you do that brought on that kind of sensation of discomfort. You might have discomfort just because you haven't done stuff in a while. And I know I have discomfort when I go outside and I work in the yard first thing in the spring because I haven't done it in a while. I should have probably, but I haven't. So pay attention to what Jerry Vaughn has to say because he's used this part of his body, but he also has used his lower body and he has a great heart. He has put his heart and soul into his activity. So I'm sure he's going to tell you some great things in terms of physical activity, but also emotional activity and being all in and what it takes to keep doing something and get really good at it and not hurt yourself in the process. So that would be the last thing we'd want to do. So when we say the shoulder, we're not just, shoulder is more than the shoulder. Pat yourself on the shoulder. It's more than that. It's a lot of things, a lot of parts. It's rib cage, it's midriff, it's all of those connections. And if you, let's see, if I don't know if you can see, but right there, there's a bone. Touch that bone right there on your body. That bone right there. There's one over here. You know, that's the start of your clavicle. Claves. That's a musical instrument. And you want that to stay active. This does not make that stay active. This makes that stay active. So if you put your hand on that and you raise your arm, you can feel it and do it on the other side so you're getting the same kind of movement. Yeah, so you're getting that activity through the shoulder girdle. And so that's the first joint of your arm. And it goes on down. So just raising your arms to here is not going to do it. But taking your arm up and over and back and make it disappear behind you, you can feel that movement making an arc with your elbow. And you don't want it to be way out here to start with because that's too far from the center point, but you can do that. You don't want to do that if you have a weight in it. Keep it bent at the elbow and back and over. So these are just a few warm up exercises, and I want you to feel that motion as you take your elbow back of your body. See, mine disappears. So you're lifting it up and over. Yeah, and if you have a back on your chair that's close, be careful of your funny bone because it's not funny to hit your funny bone. Okay, so let's see, Robin is here. So one of the things that you might check out, I don't know if you have your half dome, half roller thing at home. I have my towel rolled up because I don't have a foam roller, and I don't buy a foam roller unless you're at the dollar store and you get a pool noodle, and that may be something that's helpful for you to roll, or a ball that's soft. I use a ball sometimes to roll out the fascia and loosen up and hydrate the fascia because it needs to be hydrated. And if you're stiff in the morning, it's not your muscles, it's not your joints. I promise you, it's that myofascial tissue that's gotten stuck. And so your muscles and joints can't move unless it is hydrated and able to move. So it's the first point of movement in anything is that myofascial tissue. That's why my dog shakes first thing in the morning. All right, so we're talking about the upper back. That's the foundation of the shoulder girdle and how it goes out and how all those bones. And this is a rotator joint. You've heard of, rotator cuff. I had to have it replaced. I didn't, but somebody may say, oh, I've had it replaced, or I had an injury from tennis in my rotator cuff. That's usually because of overuse and not using the rest of the body, but hitting the ball with the arm as opposed to the core and getting the core into it. So you're not isolating and hitting something. That way you're hitting it. That's how Serena gets, the ball over the net. It's look at my body going, turning. And instead of repeatedly doing that over time with a weighted something in your hand, like a tennis racket or a shot put, will injure that rotator cuff. It's a 360-degree movement in that shoulder, just like in your hip. Your hip is a rotating joint, a ball and socket joint. And there'll be some pictures of this so you can see how that works. So the shoulder is the same way, rotator. And as we age, we probably quit doing those activities that we did as kids where we flailed our arms all around. I know Jean probably was all over the place like that, and Hashmet was, and moving all those parts when you were about 2 years old, and 3 and 4 and 5. And then we got to be adults and we kind of just sat and we might shrug, and that was about it. Exercise is great, but exercise is usually something that you're doing to get done and in gaining. That's not always the best way. You have to have a goal. And if the goal is planting your garden, that has an aesthetic to it that will engage your entire body, not just one part. Doing this and holding it for a long time, or doing this with a weight repetitively, and you're thinking about something else, is not going to do a thing for you. And I'm sure when Jerry Vaughn throws that shot and he uses his core, that he's thinking way out there, I'm going to hit that mark. I know I can do it. I'm strong. I'm powerful. Wah! And there he goes. Listen to what he has to say about that. Maybe he will. All right, so that gives you an idea. Repetitive movements are not great because they can wear out parts, bones, and then they offload that part will get tired and offload to another part whose job it's not designed to be. So be aware of what you're doing. Remember that your shoulder blade is part of your arm. So, and your neck is connected to all of that. So right now, what I want you to do is to do a little exercise. Bring your elbows down, make a fist, point your thumb back, and then take your elbows back and point your thumbs behind you. Sit up nice and tall in your chair. Oh, make your elbows disappear behind you. So you're pointing in back of your body. Be sure you're not throwing out your chest, but keep your core engaged. And this is a little harder to do standing. So your thumbs are here, your elbows are here. Bring them back. And you will feel the flesh on your back between your shoulder blades kind of come together. You probably are not going to get your shoulder blades to come together, but that's what you want to attempt. This is a contraction of those muscles in the back that support your heavy old head and your shoulder girdle, and then bring it forward again. And then elbows back and back. Point your thumb like you're hitchhiking the other way. Come on, Cynthia, get back there. Arms are back, elbows are back, and forward. You may feel some discomfort at the base of your neck. All right. Bring it in. And now notice how that feels. You've opened up this part in the front. You contracted the back that's in relationship to that. Now, I don't know about you, but my body wants to do a hug. So let's do that. This we can hug ourselves. If you got somebody around, just give them a big old hug. I think if they're our family and we've been around them, we can do that now. You're not going to be right in their face. You can kind of come over to the side, or you can have your mask on. And just breathe, and then bring your arms down. This time, put the other arm on top. Do you know which arm you put on top? Check it out. Whatever you naturally do is the one that you do first, and then you want to do the other one because it makes a difference. So now you are contracting in through here, making cleavage, ladies, and opening your back. So we can make back cleavage and front cleavage. The front cleavage is better than the back cleavage, I have to say, y'all. And relax. So just doing that, and the thumb is important. The thumbs up, because the thumb, nerves, muscles relate to your bicep right here. So if you make a fist and do a thumb and a strong thumb, then you're going to feel your bicep really kind of contract. So when your thumb goes back, you're using the bicep. So the thumb relates to the bicep. Your little finger, your pinky finger, relates to your tricep. So when you're drinking a cup of tea and you crook your little finger, you're doing an exercise, right? Yes, that's an exercise. I just want you to know how that relates in terms of nerves and tendons and the muscles. And they all come into your spine at the base of the neck, the base of the neck, or a little higher below the occiput. Put your hands behind your ears and feel those bones at the base of your skull. That's called the occiput. And if you put your hands like that and lift up, straight up, not out, not back, but straight up, or like you were holding onto your ears and pulling straight up, then you will feel your neck lengthen, your vertebra have space in between, and you're contracting these muscles to support all that. But then when you put your arms down, you probably go like that again. Nah. All right, let's try doing something else we've done before, and we've called it the head ramp. Remember the head ramp, where you pull your chin in and make double chins? It's not down. It's just a lateral movement. If you have difficulty doing that, put your hand like this. Align your jaw with the floor or the chair you're sitting in and push straight back. And notice when you do that, what happens. So you're going back. It's like a turtle. So we're going to do that exercise. We're going to do 10 reps of the head ramp. Now, if you're in a chair that you can kind of turn yourself sideways, then I can see you bringing your head back. And then because I know this is what I do on the computer screen and looking at my phone. Sometimes I do it driving, and here's my head. And then my shoulders hurt. And you wonder why. All right, so let's do 10 very slow reps. And if you need to put your hand here to help push back. And I want to see you do that. All right, so 10 times. Pull back and do that turtle thing forward. So you're sliding it forward and back. That's 1. Shoulders stay the same. 2. Push your face out. Push your face back in. Keep going, in and out. Be sure you stick it out the other way. That's it. Do the turtle thing. We're good at that going forward part. How's this one for you? Make those double chins. But you're not dropping down. You're just going straight back. Let's do 3 more. 1, 2, 3. All right, and relax. Roll your shoulders around. Now, that one is a really easy one to do if you have a straight back chair that comes up high, like one of my Queen Anne chairs. Or if you are in the car and pushing your head against the headrest right at this part of your skull, and not the occiput, but higher at the skull part around here. But you're still doing the head ramp. And it's movement, it's not body going. So if you're standing against a wall, so your shoulders are touching the wall, that's a good way to do it too. Your shoulders and the back of your head are touching the wall. And then you draw the back of your head forward and your shoulders are still on the wall. And then you pull it back. Now, those of you I can't see, like Josie and Robin and Hashmet and Tekla and Sterling, you're doing this too, I'm sure, right? Back and forth. That's a real easy one to do in a normal kind of situation where you're sitting, or if you are watching on the screen and you're listening to a presentation and you jutted your head forward, just know this is going to hurt. And it's going to start getting hard. That myofascial tissue, those muscles are working very hard to hold your head in this position. You're going to feel it in your low back probably as well. And then when it starts getting hard, you start getting this. And then you start walking around like this, and you think, oh, it's osteoporosis. Well, pretty much it's just when you've been doing that, jutting your head forward in life. You know, win by nose. Get your neck, but bring it back. So you got the movement forward and back, and that's very important to keep that going. Now, the other direction is lateral, and I want you to think about your earlobe touching your top of your shoulder. And we do this all the time in exercise, but it's usually mechanical. Someone will say, the instructor will say, and we're very obedient students, the instructor will say, take your head to the right, and I've said it, and you're like being so obedient. And see if you can touch your shoulder. Oh, yeah, there, I sure can. Way to go, May. And then go to the other side, and someone telling you to do that is mechanical. Systemic movement and an organic movement is driven from a different space in your brain. And connecting your brain to your body, and I talked about this yesterday in Ageless Grace, that's the job of the brain. So when you're doing this, come up with a scenario maybe and relax your jaw, keep your shoulders down, you're not leaning, and let your head be that heavy 10 pounds that it is. And it's just hanging over there, and you're going to feel a lengthening. You know, I don't call it a stretch. Sometimes we take our head down that way. That's a different stretch altogether. That's towards the back along the spine. So don't mistake those two. You're going down and then hanging there for a few exhales. And then come back up nice and tall, like you're looking over your neighbor's fence because you heard they got a hot tub. And they might be naked in there. Come on, Jean, you got a hot tub, girl. And then let your shoulders melt, let your arms be relaxed. If you're sitting in a chair, just let them hang down to the side. And be sure you're not switching forward. You're just going ear to shoulder and let your hands be heavy, and then breathe in and come up. Try to brush the top of your head to the ceiling and just take your time and notice the sensation. And it may help to look up out of the corner of your eye when you're doing that. That's going to challenge your brain in a different way. And then look at the rainbow and to the other side. So you are directing it. But notice if your head starts to go down, and see if you can manage to keep it directly to the side. Or if it starts to go back, all right, directly to the side. And that's a lateral. Now, sometimes I don't like to do this because I can't manage it, but sometimes your instructor will say, pull your head. Well, that may be too much. Don't do it. Don't be pulling on your head, because where it goes is where it can go right now. And the more often you do that, the farther it will go, because you're increasing the release of the tight muscles and the range of motion. When you start pulling on it and you add weight to it, that may not serve you very well, especially if you're not in the proper position. So be aware of that. If I do anything, I just kind of rest my head, and if it's too much, I'm going this way and I'm kind of putting my head on the pillow, and then I can relax, because I like to have my head on the pillow. And then let's do it on the other side. So having that hand on the side of your head, your nervous system signals your brain, oh, we're safe. Her head's not going to go over here, and she's not going to fall out of that chair that has no arms on it. And that is a conversation. That's a dialogue that goes on between your brain and your body that you're like oblivious to, especially if you're listening to somebody talk, or you're listening to the radio or whatever. You might be oblivious to what else is going on. Just like if you're walking on the treadmill and you're watching television. You're not doing the best for yourself doing that. You want to really focus on what you're doing and feeling it, using your 5 senses to be aware. So that's a couple of exercises. Well, that's 3. That's the thumbs back, and you want to do 10 reps of those. Keep your elbows down. Take your thumbs back. Point to the middle of your back. So you do 10 of those, and then give yourself the hug, because that counterbalances what you did. You're opening your shoulder blades on this one. On the other one, you were bringing them together. So giving a hug and put the other arm on top. Then we did the head ramp turtle, whatever you want to call it, without moving the shoulders over. I'm moving my shoulders. Don't do that. Oh, making those sounds. And then just letting your head rest over to the side, and take your time doing that. So those are some really good releasers, relaxers, and very safe. If you've been still for a very long time, like any other part of your body, that myofascial tissue is going to start to get stuck. And if you've been sitting for a long time, the lower body takes a hit. So does the upper body if you're jutting forward. So just keep that in mind. Moving your arm in a 360 degrees. Very few people, and especially as we age, because we don't have to do this so much unless you're a swimmer. So if you're a swimmer and you watch Olympic swimmers, the Olympics are going to be on soon, let's go the other way. That's different. Now, if that's too much and your hand seems too far away, keep your elbow bent and still bring it around. So your elbow is coming all the way around toward the ceiling, front, floor, back wall, ceiling, front wall, floor. So anytime you're extended out, that's more, that's turning up the volume. So be aware of that if it's too much. If you have a weight in it, like you're carrying something around, or you pull your purse over too close to you in the car, you're going to get some little glitchy in the shoulder girdle. I know my purse is pretty heavy. So when I pull it over close to me in the car, sometimes I can feel it right in here. That's because I've just been driving. Not much lately. All right, let's do the other side. So if you need to bend it, that's fine. Your arm comes up by your ear. You'll feel that openness in the chest, the pectoral muscles, and you can take your thumb up, and that'll help to activate the bicep and down behind you and reaching down. Breathing in as you go up will give you the support in the core, and coming down and breathing. Oh, this is our last one of these. And then rotate out and come up the other way. Kind of use your thumb as a rudder. That may help give you something. So think of your thumb. Usually I knock my camera over when I do this because I have it pretty close. And you feel your chest open and, oh, let's do one more. And you're reaching down. You're not just sliding that. And breathing in as you go up and down. All right, shake out. Shake out. Do a little shimmy. Fingers. You know, the fingers connect. Remember, I said bicep, thumb, tricep, little finger, and all the other fingers have nerves that come up your arm into your neck. But if you watch Olympic swimmers, if you've ever watched Michael Phelps or any of those guys warming up to swim, oh my God, it's like their arms are not connected to their body. They're going warming up. They're warming up. I mean, I can't even do that. I have a colleague in the world of Nia that was an Olympic swimmer, and when she does a Nia dance, her arms, I'm just like, oh, I want to do my arms like that. Of course, she's 25 years younger than me, too, and she's been an Olympic swimmer. That's a whole lot. And it's not just this. I mean, if you watch them, it's like it's disconnected. And then they go the other way. And the arm is extended. You don't need to be doing that. If you're going to shot put, all right, let's all try it. Come on. You can show Jerry Vaughn how you do this. You twist your body and you let it go. It's like you wind up your core. You don't use your arm much. You don't use your arm much. If you'll notice, the shot stays right by the head. And it probably doesn't even extend out it much farther than that. Oh, we better do it on the other side. I'm not sure Jerry can do the other side. You might ask him where the shot would go if he used his non-dominant side. All right, so you've got your wind up, and you unwind. Oh, I'm in a rotational chair, so that makes it easy. And you unwind, and you unwind. Notice how much more strength you have, and if you have the flexibility in the middle and the strength in the core, then you'll have more thrust without much effort in these delicate muscles, joints, ligaments, and tendons, and they're fine motor movements in our hands, fingers, our upper body. If you've ever watched Balinese dancers or hula dancers, they're using their upper body strength and flexibility, but the core is supporting that. The base at the pelvis is supporting that. And so from the ground up, we are being supported. When we start to do this, then we start to take a hit in all the parts of our body. So remind yourself, head ramp, Shoulders relaxed. Everybody got the head ramp going on? All right, remember to do that when you're watching the computer screen or TV or eating. You know, this makes it very hard to swallow when you're like this. Your gullet is straight down. I don't know if that's a word, but maybe it's Southern. But when it's like this, you can choke very easily. Head ramp. And if you haven't been practicing that, those muscles don't work that way. You have to do it. And we're designed to be aligned. We're designed to be aligned. So we function with grace and ease every single day and every movement we do. And it should not be an effort. So there are several things to remember. Don't overdo it, but practice. And if you have a chance to get to the dollar store, get one of those dollar pool noodles, or if you've already got one, drag it out of the pool. We're going to roll, or if there's a ball about this big. I tried rolling on let me get it. I tried rolling on this thing that we used for our middle back vertically, but it doesn't roll very well. So what we're going to do is roll our bodies on the floor on that thing, right from here, not at your neck, from here to about here. We're not getting into the low back. It's just that part. That's going to release a lot of this. And oh yeah, that's it. It's a therapy thing, and it's nice if it's soft. If it's too hard, you may grimace. But you know, we'll make do. We can make do. Don't go out and buy anything expensive. And you know, right now they have a lot of the play balls for kids. We're not that heavy that we would break one, but they're about that big. Trying to give you a background so you could see. So rolling around on that, you are going to be yeah. You've got everything. Look at May. She's got all the toys. Okay, that's a good one. And it's soft. It's not hard. And it's not a tennis ball. God forbid it should be a golf ball. Don't do that. You want it to be soft enough that you can easily roll and it feels good. And you can hang out there and feel that release. And we'll talk about that more because that is stimulating that myofascial tissue that is so important. Because sometimes something that happens in one part of your body will manifest in another part. How does that happen? It's that connective tissue with all of its nerves and its blood supply, and it has to stay hydrated. So I'm going to have a list for you in the handout that goes with this class of things that the fascia loves and things that fascia hates. So you want to do the things that fascia loves, and shaking is one of them. So shake it, y'all. All right, that's it for me today. So you're going to be having an excellent program a little bit later on. I think Victoria is on, but I don't know where she might be because we never get to see her. So if you have any questions, my email address is always on the handout. And if you want to right now really quickly raise your hand and unmute yourself, I can answer any quick question you have. Anybody? You can unmute yourself if you want to. Anybody? Hey, T. Oh, so Hashmat is back from Florida. So, all right. So smile, Jean. All right. Let's use those facial muscles. Unlock your jaw. Oh, that has a lot to do with your neck tension too. Do the turtle. Don't do it fast. Do it slow so you can really feel. It's like you're pushing your face out and you push your face in. Yeah, you can do that. All right. You can do that anytime. Yeah. All right. Take good care. Have a great weekend, everybody.
You too.
Oh,
thank you.
See you next time. Keep moving. Bye.
Bye bye.